The first fitness test you will perform is a resting heart rate. Try and be sitting for at least 5 minutes or longer. You'll find your pulse either at your wrist, on the thumb side, next to the tendons in the middle of your wrist, or at your neck, where you can find your windpipe and follow it around until you lose the windpipe. Use your first 2 fingers. Do not use your thumb, as your thumb has its own pulse. Put light pressure over the artery. Begin the count with 0 and take your pulse for 15 seconds. Multiply this number by 4 to get your resting heart rate. The next test, you will need a blood pressure cuff, or you will need to go to a pharmacy or other health care facility to get it checked. But please record your latest blood pressure readings. The next test is a 3-minute step test. The purpose of this test is to determine cardiovascular conditioning by measuring your recovery heart rate. You'll need a step that's about 12 inches high. If you don't have a step of this height, you can use stairs in your house by stepping 2 stairs at a time, or simply march in place by lifting your knees up as high as possible so that your thighs are parallel to the floor. If you have bad knees or your knees hurt with steps, use the marching in place option. Face the step and place one foot up on the step. Step up with the second foot, step down with the first foot, and step down with the second foot. This sequence of alternating feet should be done within 2 seconds. It doesn't matter which foot leads or if the lead foot changes during the test. Continue stepping for 3 minutes. If you can't continue for 3 minutes, record the time you completed. At the end of 3 minutes, immediately sit down and find your pulse. Begin the count with 0 and start counting for 1 full minute. The recovery rate count must be started within 5 seconds or the heart rate will be significantly different. The 1 minute count reflects the heart rate at the end of stepping as well as the rate of recovery. From here, you will perform a push-up test. This is to measure muscular endurance of the upper body. For men, the push-up test is administered in standard push-up position. For women, it is done from the knees with the ankles crossed and the knees bent at a 90-degree angle. The back should remain straight and the hips level with the floor. Make sure to keep your head up and your abdominals tight. Lower your upper body so the shoulders come down even with the elbows. And for both men and women, your back must be straight at all times and you must push up to the straight arm position. The maximal number of push-ups performed consecutively without rest is counted as the score. The next test is the bent knee curl-up test. This test is to measure abdominal strength and endurance by determining how many curl-ups can be completed at a set cadence without time constraints. Begin by placing 2 pieces of tape parallel to each other and 8 centimeters or 3 1/8 inches apart on the floor. Assume a lying position with your feet flat on the floor and knees bent at about 90 degrees. Place your hands palms down at your sides. Line up your fingertips with the top piece of the tape. Slowly flatten your lower back and curl your upper spine and shoulders up off the floor until the fingertips slide and touch the other piece of tape. Return to the original position with the upper back and shoulders touching the floor but not relaxing. 1 curl up is counted each time your upper back and shoulders touch the floor. Perform the curl up at a rate of 1 every 3 seconds or 20 curl ups per minute. There should be no rest in the bottom position. Perform as many curl-ups as possible without stopping up to a maximum of 75. The final test is a sit and reach. This is to measure your trunk forward flexion and determine your hip, low back, and hamstring range of motion. Try to refrain from fast, jerky movements, which may increase the possibility of an injury. Your shoes should be removed. A yardstick or tape measure is placed on the floor. You will sit with the yardstick or tape measure between the legs with the heels lined up at the 26 centimeter mark or 10 1/4 inches and the 0 mark towards the knees. The heels of the feet should be about 10 to 12 inches apart and the toes pointed up toward the ceiling. The legs should be kept extended to the taped line on the floor. Slowly reach forward with both hands as far as possible on the yardstick or tape measure, holding this position momentarily. Be sure to keep your hands parallel and don't reach or lead with one hand. Fingertips can be overlapped and should be in contact with the yardstick or tape measure. The score is the most distant point in centimeters reached on the yardstick or tape measure with the fingertips. The best of 3 trials should be recorded. To assist with the best attempt, exhale and drop your head between the arms when reaching. Make sure to keep your knees straight.